Hey dental enthusiasts, welcome to Super Assistant, your go-to spot for all things dental. I'm your guide to the exciting life of a super dental assistant. Whether you're a pro or just love those pearly whites, hit subscribe, join the Smile Squad, and let's make dentistry a joyous adventure together. See you there. Okay, without further ado, we're gonna get started. As you can see, we have some hand pieces laid out, different kinds of hand pieces, different sizes. We also have burrs on a burr block. We will be using these for demonstration purposes and to make life easy while we try to explain. You will understand as we go. Okay, so starting with the very first one, we'll start with the straight hand piece. This is usually used for making adjustments of night guards, among many other things. As you can see, it's short, it's not very long, it's almost as long as a finger, and it has the lock and open dials, so you just twist it accordingly. Usually you're closing when you're trying to put a burr inside. I'm going to demonstrate that. 1 second. But I'm just showing you how it locks and opens before you put in the bar. So this is usually an acrylic burr that's used in here. It has a long base and a shorter tip. It goes on the top where you use the close and the open dial that I just showed you. Push it in, make sure it's firm, and then close it. That dot should be on the close, so it shouldn't be able to pop out. It should be easy to use. So an acrylic burr is used with a straight hand piece as demonstrated here. And when you're taking it out, you just dial it back to open and slide it out. It's as easy as that, but just in case you didn't get it, I'm going to show you a different kind of straight hand piece. They come in different brands and types, and this is also one of those. It's as short as the other one, as you can see. Same application, put it in and you twist. So you have to check if it's open or closed, because if it can't go in, then it's probably closed. Slide it in, close, make sure it's firmly placed inside, turn it the other way and open, and yeah, there you go. It's as easy as that. Okay, moving on to high-speed hand pieces. These are usually used for cutting and shaping dental materials such as enamel, dentin, and ceramics as well. They come in different shapes like these. You can see one of them has a smaller head, the other one is a slightly bigger. They kind of look the same at the back, but for the most part, it's usually the shape of the head. It's the same thing, does the same job. So I'm going to show you how to put a burr in there. And it usually works with burrs such as these. Press the back, slide it in. It's as easy as that. You don't have to think about it too much. Press the back, slide it in. Same thing to take it out. You press the back and pull it out. You don't have to think about it too much, as I said. And yeah, that's basically what it looks like. The dentist usually does this, but it's a good thing for you to know, because before sterilization, some dentists leave the burrs in the hand pieces and you have to know how to take them out. So that's very helpful. I'm going to demonstrate with another burr. You can see it has a smooth end, doesn't have a latch on it. That's how you know it's very likely used with a high-speed dental handpiece. And yeah, same thing, press the back, make sure it's sitting firm, and then take it out, same thing, pull it out, and yeah, all done. Those are easy and pretty straightforward. And yeah. Okay, now we're going to move on to the slow or low speed handpiece, usually called interchangeably. Could be called a low or a slow speed handpiece. And these are usually identified as being much shorter than the high speed. So that's the easiest way to tell the difference. Otherwise, they pretty much almost look the same. And as you can see, I'm using a latch type burr. And those are the type of burrs that can be used with slow speed handpieces. They're usually used like for things like spinning a cutting burr or a prophy cup, and also for removal of caries and refining cavity preparation, performing prophylaxis and other endodontic and implant procedures. But here I'm demonstrating how you can use a latch type burr to put it in. And I'm using a prophy cup. It also has a latch type at the end, and that's how you know that's probably for the slow speed. Put it in, make sure it's firm, easy to take out, easy to put in. Same thing, push it back and pull it out. It's as easy as that, just like the high speed. And yeah, there's usually digits on there, and they kind of let you know what the RPM is. Next, I'm going to be showing you a surgical handpiece and how to use a burr in it. It has a very similar shape to the high speed and very easy to confuse the two. But as you can see, the head looks different, and yeah, everything else is basically the same in terms of how you use a burr in it. So I'm using a surgical burr and I'm going to place it in this surgical handpiece. It is basically the same thing. Push the back and put the burr in the handpiece. Make sure it's secured and does not come out at all as the operator is using it. Same thing to take it out. You just push the back and slide it out just like that. And yeah, that's basically how you use it. It's as simple as that. Next is this endodontic handpiece, and usually shaped like this. Looks very similar to the slow handpieces, and these are specialized dental instruments designed to clean and shape canals during root canal treatments. And they have the ability to drive endodontic files with precision, prevent file breakage or binding in most cases. So it's very easy to mix the two up. However, it is a little skinnier than the slow hand pieces, as I've shown you. And yeah, that's the easiest way to tell the difference. But yeah, it's usually used for endodontic treatments, and this is how you can identify them. This right here is an implant handpiece, which has been specifically designed for oral and maxillofacial surgery. As you can see, the small nozzle and the insert for the tubing for irrigation during surgery. It does look similar to the slow speeds, and it definitely can be confused, but with the nozzles, that's the easiest way to tell the difference. We will be making a video later showing you exactly how to set this up for a procedure that is gonna use the handpiece. And yes, this is me showing you the differences. Very, very similar, but it's also easy to tell the difference if you know that one of them has a nozzle for irrigation. That's it for today's video. Thank you for watching, and I can't wait to share the joy of dentistry with you. Until next time, please subscribe, like, and share.